Hello, hi, I'm Dr. Monica Singh. I'm a pediatrician and also the co-founder of MotherYourChild. Today's video will be about tongue tie or ankyloglossia in newborns. Normally what happens is the tongue is connected to the base. There is a tissue that connects the tongue to the base of the mouth. In tongue tie what happens is the tissue connecting the tongue to the base of the mouth is either very short, tight or very thick, which restricts the movement of the tongue. Now, when newborns experience restriction in the movement of the tongue, it causes breastfeeding issues in certain newborns. Now, what happens is while latching, the baby extends its tongue and takes the nipple areola complex in its mouth and forms a proper seal with it. But in certain newborns who have a very thick or a very tight tongue tie, they're not able to do it properly. Some babies who have a very tight tongue tie may also find it difficult to make the movement necessary to squeeze out milk from the mother's breast. So in babies who have tongue tie, the problem is basically because of improper latching and difficulty in sucking. There are 4 types of tongue tie. In the first one, the tie is at the tip of the tongue. In the second one, the tie is in the middle of the tongue. In the third one, the tie is at the base of the tongue. And in the fourth one, the tie is beyond the base of the tongue, that is in the mucous membrane, the soft tissue of the tongue. Now, how do you identify tongue tie? Infants who have tongue tie find it very difficult to move their tongue from side to side or also to the roof of the mouth. They are not able to stick out their tongue, and when they stick out the tongue or when the tongue is out, it appears heart-shaped or notched. Why is it heart-shaped? Because the lingular frenulum is pulling the tongue and hence the notched appearance. Now, what are the problems that tongue tie can have in newborns? Newborns, they can have breast refusal, as in they will not accept milk from the mother's breast because they know that it is difficult for them to suck from the breast and extract out the milk. Then they can have fall in weight or difficulty in gaining weight because they're not able to efficiently extract out milk. They can also have difficulty in sleeping and excessive crying because the infant is always hungry. Later on, such infants with short frenulum, if they're not treated, they also develop problems with eating, swallowing and speech. The tongue tie can also cause some potential problems in the breastfeeding mothers and can also hamper the whole breastfeeding experience for the mother. The mother might experience low milk supply because of improper latching and ineffective sucking on the baby's part. She might also go in for early weaning because she feels that the milk supply is inefficient. The breastfeeding is very painful for her because the infant is not able to latch properly, and she also feels that the infant is always hungry and always crying and also not gaining weight, which makes a switch to weaning early on. The mother might also experience emotional stress because she's not able to breastfeed her infant properly and she feels she's not able to provide for the infant in a way that she should. The mother might also experience some painful breast problems because of improper latching again. She might have breast engorgement. She might also have mastitis, sore nipples. Now, how is tongue tie treated? If the tongue tie is asymptomatic, the baby is able to feed properly, the mother is having a painless breastfeeding experience, and the infant is gaining weight, in most of the cases, such tongue tie do not need any treatment. But if the infant is not able to latch properly, if the mother is experiencing a lot of pain while breastfeeding, or the infant is not able to gain weight, such tongue ties might need treatment in most of the cases. Tongue tie is treated by a surgical procedure. It's a minor surgical procedure. Tongue tie is treated surgically by frenotomy or frenulotomy. It's the same thing, where the frenulum is cut surgically. The procedure is done under local anesthesia, causes minimal pain and bleeding. It heals quickly, and then the mother can go on to breastfeeding her infant properly. I hope this video was helpful for you. If you have any questions about tongue tie or child health in general, please feel free to ask. We are utterly grateful to you for taking out the time to watch this video. Happy parenting. Bye-bye.